Hi, it's Dr. Marion Owen with Whole Family Medicine. It is March of 2025, and we are having a large outbreak of measles in Texas and New Mexico, and several smaller outbreaks in many states around the country. That is happening because overall immunity in the United States to measles, mumps, and rubella, or measles in particular in this case, is waning because of decreased uptake of vaccination in childhood. So I want to talk about I want to talk to you, my patients, about what you need to be doing to protect yourself in this context. So first I'm going to talk to my adult patients, then I'm going to turn to pediatric patients, then I'm just going to describe the natural course of measles so that you can recognize it if it occurs in your life, and then I'm going to address a few current talking points that I have heard in social media chit chat. Not that I participate in social media, but other people have brought these points to me. I recommend you just don't participate in social media. It keeps you sane. But the talking points that I've heard, they all have this little kernel of truth, and then that kernel of truth seems to be expanded, and that's because of the nature of social media. If I'm a social media person, I want to get and keep your attention. That's how I make money. That's not how I make my money. So, but if I were, I would want to be sensational. I would want to get your attention. I would want to tell you that I have solutions that no one else has so that you turn to me and trust me. And so there are certain things that have kernels of truth that have then been expanded and beyond what the truth actually is to generate fear, and then to generate a desire for new understanding or new things we can do to protect ourselves. So I want to address those as well. So in the context of measles and measles alone, let's talk about you grown-ups in my practice. So if you are an adult and you were born before 1957, you have probably had measles, whether you remember it or not. From that measles infection, you will have lifelong immunity. If you are concerned, you don't have memory, or one of your parents told you, oh, you never had measles, it was just amazing, then you want to come in and we can check your immunity, and we can do that through a blood test. It's very simple, and we can make sure that you have antibodies to measles that are circulating in your body. Now, the antibodies to measles are not necessarily how your body is not the only way that your body is remembering, but we can't really test the side of the immune system that probably is more active in the immunity were you to get exposed. And so that's all we have to go on. So that's what we'll go on. If your antibodies are low, we'll revaccinate you, even though that really may not be necessary. But the vaccine is very, very safe, and we can do it that way. If you're an adult that was born between 1957 and 1967, there were vaccines that were being produced in that period of time against measles that were using killed measles virus. And because that virus was killed, it couldn't take hold in your body very well. And so you develop some immunity, but that immunity may wane with time. So if you were born between 1957 and 1967, you should come in and let us check your immunity, and then we'll give you an MMR vaccine if you need one. And why do I keep saying MMR vaccine instead of just the measles vaccine? Because there is no single measles vaccine. To get a measles vaccine, you have to get measles, mumps, and rubella. Rubella, I'm really not worried about in adults. It can cause birth defects in non-immunized women who are pregnant when they get infected. And mumps, hopefully that one won't come back, but if it does, it might be a bigger issue because that immunity does wane with time after the vaccination. And everybody's going to probably have to come in and get vaccinated. So that's another blah, but I'll make another video about it if it happens. So again, 1957 to 67, come in, we'll check your immunity. If you're born after 1968 and beyond, it is almost a dead certainty that your parents got you immunized with the new MMR vaccine, 2 doses, because they remembered how bad measles was and they didn't want you to get it because they loved you. So the measles infection caused high rates of death and high rates of illness and prolonged sickness and immune dysfunction for a period of time afterward in many, many, many people. And so parents were very eager to get their kids vaccinated. So those of us in that age range, got our 2 MMRs and we're good to go. There is a small diminution of immunity over time. That rate seems to be about 0.04% per year. And if you got 2 vaccines, then you got up to 97% covered. So you should be fine unless there's like some massive outbreak and you're just getting exposed over and over and over again. And then maybe everybody should get the MMR. But right now, I'm not worried about you. If you're worried about you and you want to come in and get your immunity tested, that's fine. We'll let you do that. But I am not checking my own immunity and I don't feel the need to do so. Okay, so that's the adults. Children. In our practice, we have a slowed and delayed vaccine schedule. We do rarely more than 1 or 2 vaccines at a time. Certainly in our youngest children, we don't do more than 2. And that is not so much that I'm worried that the vaccines are really going to do something, but why rush it? My patients tend to have time to come back and get another vaccine. So we tend to do an every 4 weeks, let's slowly get this child up to date. By kindergarten, we try to have all of our children in our practice up to date. We do have some parents that don't want to vaccinate at all, and we have a policy of supporting them. Some practices will fire families from their practice that don't vaccinate. I don't choose to do that because I believe that having a trusted medical provider is more important, and I want to support my families where they are. As long as everyone has heard my concerns, I will support you making the best decision you think you're making for your family, and I'll just hold my breath when I disagree with you. But now, so our practice had been to vaccinate for MMR at 3 years old. And the reason we picked 3 years old was because there was one study, well, it was a big study that pretty much said, look, MMR vaccine just doesn't cause autism, except in this one subgroup of people, Black males. Black males that were vaccinated between 12 months and 36 months did have increased autism over their cohort that weren't vaccinated in that time period. And so because of that data, we're like, well, let's just wait on everybody to 36 months. No harm because measles isn't around. But now measles is around, and so the calculus changes. When your risk goes up, the risk benefit shifts. And so we have to kind of make this decision in today's reality. And so I'm encouraging my families in my practice who have children under 3 who have not yet been vaccinated against MMR to please come on in and we'll get your child vaccinated. My concern about the risk of that is very, 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 very low. And my concern that your child might be exposed to measles is going up and up and up and up. So I would just encourage you to come on in. And if you want to talk that more, we can make an appointment to discuss that before you get the vaccine. I'm happy to do that. Okay, so the most severe infections with measles happen in a child less than 12 months or an adult over 20 years old. So between 12 months and 20 years old, the infection tends to be less severe. Still, it's a severe infection, but it's less severe. And so because infants from birth to 12 months are not eligible for the vaccine, that's the population that I'm actually most concerned about. That population often has older brothers and sisters that come home from school, that go around, parents that are going to work, so has exposures that they can't control that increase their risk of exposure to something they cannot be vaccinated against. So because of that, I encourage all of my children under the age of 3 between 12 months and 36 months and older. If you're over 36 months, we've probably gotten it done by now, to go ahead and get vaccinated against MMR, measles, mumps, rubella. To do that as soon as you can get that scheduled, and we'll work you in just like that. No problem. Come on in. So because our most vulnerable cannot protect themselves, it's our job to protect them. And now I want to just talk a little bit about what measles, sorry, I keep saying measles and mumps. It's because of the name of the stupid vaccine. What measles looks like. So when you're exposed to measles, you're in a room, you're unvaccinated, you're at risk, and measles is in the air. The measles virus stays suspended in the air for up to 4 hours in tiny little respiratory particles. And 90% of the people exposed in a room that are vulnerable to it will get infected. It's highly contagious. So it's not like, oh, you can keep going to the grocery store if you're not immune in an area where there's been an outbreak. It's a severely contagious disease. So usually from 7 to 18 days, usually 10 to 12 days, you won't have any symptoms. And then you'll start having what looks kind of like the flu: cough, fever, body aches, runny nose. There'll also be a lot of redness in the eyes, conjunctivitis. And on the inside of the cheeks, you'll see these tiny little white dots with like a bluish center. If I'm remembering right, those are called Koplik spots, but don't quote me. So those are the kind of things we look for. And honestly, we don't want to look for that in our clinic. So if measles really gets big around here, we're not set up to have a negative air pressure room. We're not going to be able to see you in clinic because we don't want to be exposing other people. We'll have to figure out how to see you in your car or for me to come to your house or whatever, but I'm not going to want really sick kids coming into the practice if there's a big measles outbreak. Okay, so anyway, then from 3 to 4 days after those symptoms start, you get the rash. The rash typically starts on the face, behind the ears. It's flat, red, polka dots, and patches, and often those will just blend together into one big bleh. And it can be itchy. It spreads from the top down, so it comes from the head and behind the ears, down the neck, over the trunk, and out to the extremities. And this is when kids tend to have a high fever. And this is the time of contagion, 4 days before symptoms even start until 4 days after the onset of symptoms. That's when you're contagious, which means you might walk through the grocery store not knowing you're contagious and make a whole bunch of people sick. And that's not someone you want to be. So then after 2 to 3 more days after the rash starts, generally the rash will start to resolve, the fever will resolve, and then there'll be a prolonged period of fatigue. And then we start seeing complications because it's a pretty aggressive viral infection. Secondary bacterial infections like to come right along behind. So 1 in 20 children or people infected will get pneumonia. 1 in 10 people will get ear infections. In the day of antibiotics, we're better at treating those. 1 in 1,000 will get an encephalitis. That has no treatment. The only thing we can do there is keep someone comfortable. And then 10 to 15% of people will have a prolonged immune suppression. There's something about having measles that kind of kills your system's memory for things that you've already been immune to, things that you've already seen and fought off, like this year's flu. You had it, you're not going to have that version of flu ever again unless you get measles, and then it'll kill your immune memory. And that immune memory loss can last for years. Then there's a very tiny group of people, like 1 in 25,000, and it's rare, but it's horrible, who get better, and then like 7 to 10 years later, suddenly they just have this massive neurologic regression. And I remember this name from med school because it just sounded so horrible. Subacute sclerosing panencephalitis. It's just not the kind of thing that you ever want to see, to diagnose. It would just be a horrible, horrible thing. And so whenever there's something like that where it's just like, oh my God, I don't want that to happen to anyone I love or care for, and there's something I can do to keep that from happening, I'm going to be pretty strong advocating that you do that thing. And that thing is vaccinate your children. The mortality rate is between 1 in 3 per infected individuals will die from this disease. We can do nothing about that. It's the virus itself causing those deaths. That's a pretty high death rate. And that's across all age groups. Okay, so I'm encouraging you to bring your kids in and get them vaccinated if they have not yet been vaccinated against that. And now I want to talk about the little odd things that I'm hearing on the internet and actually from patients who are on the internet that I'm trying to avoid. One is about vaccine risk generally. So there have been 15 large, going back through time, case-controlled studies in multiple countries, like 15, hang on, I wrote it down because it was good. 15 studies in 7 different countries over large populations that show no increased risk of autism from measles, mumps, and rubella. That is pretty clear. The only group, as I said before, is African American males between 12 and 36 months. So we want to vaccinate ourselves to protect them. We want to vaccinate ourselves to protect infants under 12 months who can't get this vaccine. So that group is the only group that does show an increased risk of autism. Full stop. What's it about vitamin A or cod liver oil? And the reason cod liver oil is because it has high vitamin A. Okay, so here's the thing about vitamin A. There are many, many countries in this world that, as a general, just their populations are vitamin A deficient due to diet and exposures. So they just don't get a lot of vitamin A. And children who get measles, when they are in a vitamin A deficiency, are going to get a worse case than kids who are vitamin A sufficient. Vitamin A sufficiency does not prevent measles. It does not prevent death from measles. But in the United States, if you're admitted to the hospitals with a severe case of measles or measles-related complications, you will be given a vitamin A vaccine shot. You'll be given some vitamin A to boost your vitamin A levels just in case that's contributing. But vitamin A or cod liver oil are not protective against measles. They will not stop you from getting measles. They will not stop you from dying of measles. They may lower your risk, but it's not a treatment. It's not an instead of. And then this idea of, I can't even believe I'm saying this, exposure parties. So back in the day, before there was a vaccine, as I remember I said, who was most likely to die? Infants less than 12 months and adults over 20. So if you had an older child who had not yet had measles, it kind of made sense. Maybe before they become 20, we should go ahead and get them the wild measles, let them get caught, let them catch it. And so there were like measles catching parties. I can't imagine making that decision for my child because it's still a deadly disease. 1 to 3 in 1,000 die from natural infection. But it was a better risk than waiting till they were older. And so then, again, that risk-benefit thing, if the only way you have of protecting your child against measles is to give it to them when they're least vulnerable, well, then you do. That makes sense. But now there is a way to 100% protect your child from measles that will not increase their risk of death or autism or anything else. It's to get the MMR vaccine. That's how you do it. So I really, again, just encourage you to do that. If you have other questions or other things that you've seen, I'm willing to dig into the research. I want to understand, where does that claim come from? And then what is the twist that's happening in the social media, or the, hey, look at me, watch me, I'm the only savior out there for you, buy my vitamin, buy my this, that, my glow box, whatever it is they're selling. If it's after frightening you, it's probably not worth it. So again, I care about you, my patients. I want you to be well. I want you to feel safe. So if there's any questions I can answer, any way I can help you think through this, I am here for you. I will sit and talk with you as long as it takes. And I hope that this was helpful, and I hope I didn't sound too alarmist. I do feel a lot of passion around it, so it's hard. Like, it took me forever to decide to make this video because I just didn't want to because of this. And it's because, honestly, it's because I care. Okay, I care, and I'm right, and I know I'm right in my heart. So, in my brain also, that brain that you trust for a lot of other things. So I hope you'll just come along with me and give me an opportunity to address your concerns. Know that I am here for you if you need anything, even if you get measles. No judgment. I'm just here for you. All right. Be well. Bye.